Hi, this is Devin Lockett. I'm here at the BiomedRx Health Center, and this is a video about biomagnetic pair therapy. Biomagnetic pair therapy is one of the therapies that we offer here at the BiomedRx Health Center. In addition to neurofeedback, cranial electrotherapy stimulation, PEMF, and a number of other things. It is the brainchild of Dr. Isaac Goiz Duran, a Mexican physician and scientist. Dr. Goiz has developed a system that we can use to depolarize relationships between pathogens that occupy the body. Viruses, bacteria, fungus, parasites, and even heavy metal toxin burdens can be released from the body through the application of permanent magnets. The positive side of the magnet affects the body with tension and acidity, or lowering of the pH. The negative pole of a magnet affects the body with relaxation and the raising of pH, or alkalinity. Biomagnetic pair therapy is effective at alleviating many diseases and helping the body to rid itself of many toxins. It is a process by which we can assist the body's own immune system in ridding itself of these pathogens. When the blood, or the milieu of the body, is acidic, your red blood cells tend to stack up like these magnets right here. They tend to stick together in forms of stacks or chains of red blood cells, and this is something that the red blood cells do to protect themselves. But this condition inhibits blood circulation, and it also prevents your white blood cells from growing to their proper size, which is 3 times the size of the red blood cells, and from traveling through your bloodstream and ridding the body of toxins, doing their job. When your blood passes beneath the magnetic field, the magnets polarize the iron in your blood as well as the hydrogen which is in your blood. And that helps the red blood cells to unstick from each other. It also helps improve circulation. You might remember when you were in grammar school, we had the science experiment where you take a piece of cardboard and you pass a magnet underneath it with some iron filings on top, and you can see all of the iron filings or maybe magnetic shards of metal would stand up in certain lines. They would polarize themselves in accordance with the magnetic lines of flux from the magnet. Well, this is the same way the magnets affect your blood beneath your skin when the blood is passing through the magnetic field. This process is akin to opening a sponge, because your red blood cells are actually supposed to be negatively charged. They're not supposed to stick together. They're actually supposed to repel each other, because they're supposed to have like polarity. They're supposed to all be negatively charged. When you have a pocket of alkalinity, for example, in the body, an area with, for example, you may have a bacteria, right? I'll use the bacteria as an example. It may raise the pH too high. You may have a pocket of alkalinity or an area that's too basic. And there may be another area of the body that is acidic, where the pH is too low. And this relationship between a pocket of acidity and a pocket of alkalinity is what we call a biomagnetic pair. Sometimes you may have a virus. The virus could reside in, say, for example, the colon, right? And it would make the colon very acidic. It would lower the pH of your colon. But that virus could only be holding on to your body because there is another area of the body that may be infected with a bacteria. And that bacteria can create a pocket of alkalinity. This is the case often with viruses and bacteria. The thymus gland, for example, tends to be a reservoir of the E. coli bacteria. And so if you have too much E. coli in your body, the thymus gland could be alkaline, could be too alkaline. And if you have a virus in your colon or in any other organ, it could make a pocket of acidity depending on the virus. That relationship between the acidic pocket or reservoir and the alkaline reservoir is what we call a biomagnetic pair. By placing the positive pole of the magnet onto the area that is alkaline, or where the pH is too high, we can then bring down the pH of that area. By placing the negative pole of a magnet on the area that is acidic, we are helping to bring up the pH of that area, or to introduce alkalinity, or to reduce the acidity of that area. The magnets that we use come in all shapes and sizes and strengths, and you have to use the right magnet for the right job or for the right pathogen, especially for the right patient. We have small magnets here that are good for use on the face and for children and on the head. We have medium-sized magnets that are good for use in various areas of the body. Okay. We have teardrop-shaped magnets. The teardrop, the point on the teardrop, is useful for using clips to clip the magnet onto the area of the body where you want to apply it. We have the standard rectangular magnet. Okay, these are some of my favorites. Okay, I use these magnets primarily on the wrists, inside the elbow, different areas of the body, behind the knees. Okay, very good, very effective. And these magnets, now all of these magnets are made of ferrite, which is what we're accustomed to when we see magnets. It's the same type of magnet that we see in the refrigerator, the gray type of magnet. It looks like a metal, but it's actually a ceramic magnet. Those are called ferrite magnets. These magnets are what you call rare earth magnets. These magnets are from Spain. They're kind of expensive and they're very strong. As you can see, the like poles repel and the opposites attract, right? The red and black stick to each other. The positive and negative stick to each other. Okay? They're also teardrop shaped so that we can clip them on. And I have a pair of very strong magnets. These magnets are what you call unipolar magnets. One side, one magnet, they're very strong, hard to pull apart. One magnet is all positive, the other is all negative. What you see here is a coil or an inductor. The coil is applied to the magnet so that it can take all of the magnetic energy and push it out like a magnetic laser. Okay, comes out straight through the body, positive and negative. Click very strong to each other. I think these are 200 Gauss or maybe more, 2000 Gauss, I'm not sure. But they're very strong magnets. And these are the strongest rare earth magnets I have. As you can see, they're sticking through my fingers. They will actually stick through my hand. Okay? Yep. And these are the magnets that I would use in helping a person to liberate themselves from HIV infection, for example, or to help the liver with hepatitis or fatty liver disease or a number of other conditions. We're going to take a look at how we apply this on a client or a patient later on.